Goals and values. These are two of the guiding forces that not only determine what the course of your life is going to be, what you achieve, who you show up as, but did you also actually know they also play a huge part in how you communicate, connect, and relate with others. Now, based off a podcast I regularly listen to, I thought in today's video, let's talk about the differences between conversational goals and conversational values, and look into what we as healthcare providers should emphasize on when we're in consultation or communication scenarios with our patients, with the ultimate aim of building authority, influence, and trust with them. Welcome back to my YouTube channel, everybody. As always, thank you very much for your ongoing presence, engagement, and support, and the views that I've been getting on this channel. It's always appreciated and it never goes unnoticed. So for those of you who are new on here and who have never met me before, my name is Shweta. I'm the founder of Healthy Dynamics, which is a coaching practice that essentially helps healthcare providers who work with patients and are from non-English speaking backgrounds become more empathetic, impactful, and trust-based communicators. And essentially what I really focus on is helping them navigate challenging, tricky, difficult conversations that they have on a day-to-day basis in their jobs as healthcare providers, predominantly with their patients. Now, a lot of you may actually know, or if you don't, I'm going to tell you right now, that I am a huge fan of Mel Robbins. I've been following her work ever since she started to become famous, and she started to gain a lot of followers. And I'm a regular listener of her podcast, Mel Robbins' podcast. I'm going to leave the link of that up here. And if you recall one of my past videos, I did actually cover the concepts of one of the episodes of her podcast. So again, I'm going to link that video over here. And just a couple of weeks ago, I happened to listen to one of the other episodes in her podcast, which actually specialized on communication. And I just thought, let's sort of extract some of the ideas of that and present it to you guys, and also customize it, fine-tune it in terms of what would benefit you as a healthcare professional when you are in communication with your patients. So I'm going to leave the link to the entire episode over here, so do check that out. So in this episode, she's interviewing a communication specialist by the name of Jefferson Fisher. And when I heard the whole episode, I had to listen to it a few times. I decided to give him a follow on LinkedIn because I can actually learn a lot from him because he's in the same space as me. And who knows, I might be or featured on this podcast at some point, which I am really looking forward to. But anyway, Jefferson and Mel essentially talked about the differences and the two concepts of conversational values versus conversational goals.
So thrilled that you are here. Where I would really love to start is, Jefferson, could you tell the person listening how their life might change?
And I thought I would just turn its head in and sort of change that, put a different spin on it, and talk about communication goals versus communication values. Now, there may be similarities and there may be differences between them, but I'm just going to define each of them for the time being and give you some examples. And in the end, we'll focus on which one you should set preference to and which one you should give more emphasis and importance to. So let's get straight into it. So a communication goal essentially talks about verbatim the script of what you want to say and how you want the conversation to look like, what each party in this conversation is going to get out of it in the end of the conversation. And it can be very sort of methodical and very systematic. Now, so that's really what it focuses on. So there's a start point, you know exactly what you're going to say, you are prepared for what the other person might ask you, or they might challenge you or question you, or you're coming up with, if there's a conflict in the conversation, you're prepared for that. So there's a lot of contingency management that goes behind this sort of preparation as well. So it can be quite, as I said, it can be quite script-based. Now, let me give you an example of what conversational or communicational goal is. So not too long ago, I was working in healthcare. Without going into too much detail, my role in healthcare involved speaking with patients on an everyday basis. And that role was quite intense and monotonous because I was asking the patients the same questions every single time. And so, and at the same time, you just have to literally follow a script. And I had to do it on an average day, you're talking about 100 times a day. And obviously, if there were, depending on what else I had to do, if there were, some of the appointments that were a little bit different and more complex ones, I had to ask more questions. Now, obviously, on that, the goal really was more than having a conversation. It was that I had to follow the script within a time frame, had to make this many bookings within this many minutes or hours. So it was very performance and process driven. So in that situation, the conversational goal is that I get through the script. I tick all the boxes in the script so that, I'm in the good books of the organization, I'm meeting the quality standards, and also I'm giving the patients what they want, which is a booking, and they know the details of the booking. So the date, time, where they're coming to for their appointment, and any preparation that they need to do. So that is the ultimate goal of doing this. So whereas in many of those interactions, and I'm quite proud to say in a substantial number of those interactions, I actually made a very positive impact on the patients by doing what I always do, which is, again, just literally following the script. But most of the patients who I worked with really liked me. And the reason for that is because I made the conversation with them with the aim of actually not only hearing them out, but also connecting with them. And that is not easy. That is particularly challenging. You, as healthcare providers, you may also feel that if you are speaking or if you're in a consultation which has to be done in a very quick manner, and it's quite typical of GPs who will do this, like they'll have a line of patients waiting for them in the waiting room. So you have literally a very short amount of time. So yes, you have to meet those conversational goals. But when you are, again, you're showing that you are really wanting to help them, really wanting to serve and support them and make a difference in their lives, and giving them the information that they want, showing empathy, listening actively, everything that I talk about on this channel. That is what conversational value or communication value talks about. So that's all the softer, the more subtle yet very important aspects that we should really be focusing on if we want to communicate and build a relationship and communicate with impact. And that is why during those routine, mundane, monotonous and repetitive interactions, I could really make a difference. And some of the ways in which I did that is, say, for example, I would ask them how their day is going. If it was close to the weekend, I would ask them what your plans for the weekend are. And sometimes, if we would have some common ground. So in the background, I would hear their dog barking, and as everybody knows, I love dogs and I have a dog myself. So that became a good common ground by which we would sort of talk about. So going that extra mile really helped patients. It made them feel like, I care about them, that I'm showing empathy and I'm being compassionate and I'm understanding where they're coming from. And that is what conversational value is. So it's not just a routine, it's very case-by-case basis. It really depends on, what your patients' pain points are, what challenges that they're going through, what kind of skills, the more soft yet very vital skills that you need to bring to the forefront to make them feel good, make them feel like they are being heard, validated, and understood. So that is where the difference is between communication goals and communication value. Now, as a healthcare provider, what should you be focusing on? Now, in this podcast episode, one of the very early sentences Jefferson actually mentions is that what you say is who you are. And I'm going to be making a separate video on that, or by this time I may have already made that, so go out and check that out on my LinkedIn. But what you say is who you are. So it really depends on what kind of feeling you want to leave your patient with. What I mean by that is there is going to be a big difference between a patient who just walks in to any healthcare provider. So say, for example, you may be a GP and you have that 10-minute window that you have to see every patient for within that sort of time frame. So in that case, so say, for example, that patient comes and tells you, I'm experiencing symptoms of stress, depression, anxiety. And obviously in that situation, they will refer you on to a specialist, but they have to go through some routine questions so that they can get you to the right place. And so as a GP, what would you do? Would you just go through the routine questions one by one to work out what their symptoms exactly are before you give them a diagnosis? Or whether you would say things like, on top of their responses, you would say things like, I feel for you, or I understand this must be very challenging or difficult for you, whatever the case may be. So these few words, by just saying that, see the difference between when you're just following a script, say, for example, when you have depression, you can things like, how your moods have been, how your sleep has been, how your appetite has been, have you had any motivation, how productive or otherwise you've been. That's very routine. But what is going to make a difference between the routine and something that is of substance is when you incorporate the principles of communication values. So during this time, just as an example, as I said, I'll be saying, if you say things like, this is a difficult or challenging time for you, we're all here to support you, and referring them on and giving them that confidence and assurance that they're in a good place and that you will get through this together, really hits on those core principles of communication values. And it is really going to leave a positive impression on you with the patient as a healthcare provider. So in a nutshell, that is exactly what the difference is between a communication goal and communication value. Now I can say, now that we're talking about GPs, it's very difficult to find a good GP, and the one that I'm currently with absolutely exemplifies everything about communication values. She is very empathetic. She's very understanding. She treats every patient on a case-by-case basis. She, does not cut you off. She does not condescend. She does not dismiss you. She doesn't do any of those things. She really hears you out and really focuses on being someone that patients can trust and go to and be a good communicator in every sense of the word. So so those are some differences between communication value and communication goal. As always, make sure that you hit the subscribe button and the notification bell to receive more videos and content on how you can be a better communicator and navigate through the challenges of communication in the healthcare space as a provider with your patients. And as always, thank you very much for your time, attention, presence, and support. And I will see you next week, same time. Cheers.